As promised, if you subscribe, I'll make content you are looking for. And this one comes courtesy of Adriana Vanucci, 4129, who's been on her weight loss journey for a year and a half and has subscribed to this channel the whole way. She wants to know about Hydroxy Elite as a maintenance med for weight loss long-term after coming off the GLP-1s, and I'm happy to answer. So if you're like Adriana and you've lost weight on a GLP-1 like Wegovy, Ozempic, or Zepbound, first of all, congrats. But here's the truth no one tells you. Stopping your medication without a plan is a fast track to regaining everything you worked for. The studies show most people regain up to 2/3 of their weight within a year of stopping GLP-1s, unless you've got the right tools to maintain the weight loss. So today we're breaking down 7 medications that can actually help you keep the weight off after you hit your goal. Some are FDA approved, others are a little bit more controversial, but all of them are being used right now to extend the results of GLP-1 medications. Let's start with the most over-the-counter used and the most overhyped. Number 1, Hydroxy Elite. This is the one Adriana wants to know about. This is one of those fat burners you'll see on fitness websites and supplement shelves. It contains DMHA, which is a stimulant similar to the now banned DMAA, along with caffeine and rauloxine, which is a yohimbine analog. Mechanism-wise, it ramps up energy expenditure, blunts appetite, and for some folks, sharpens focus. Sounds great in theory, and actually come to mention it, it sounds a lot like Adderall, right? Anyway, here's the catch. It's not FDA approved for weight loss, and the stimulant profile is no joke. Think side effects like elevated heart rate, you get anxiety, insomnia. It just ramps you up, and especially if you're sensitive to stimulants. If you're considering it, make sure your heart and mental health are in a good place. This is a buyer beware supplement, not a long-term maintenance solution for everyone, and not one I'd recommend first line. Next up, one of the most underrated options for post-GLP-1 support. That comes in at number 2, naltrexone plus bupropion, better known by the brand name Contrave. This combo targets both hunger and cravings. It works on the hypothalamus to regulate appetite, but it also hits the reward centers of the brain, reducing that compulsive urge to eat when you're stressed, bored, or emotionally triggered. That makes it a strong fit for anyone who's struggled with sugar cravings or binge eating even before starting a GLP-1. And because it's a non-stimulant, it's a safer bet for long-term use, especially if stimulants like phentermine never sat right with you. Let's talk about number 4, orlistat. It's sold over the counter as Ally, and the same medication is also sold by prescription as Xenical. It's one of the few weight loss medication that doesn't work on your brain at all. Instead, it works in your gut, blocking the enzymes that digest fat. So about 30% of the fat you eat passes right through your system. Literally. And that's the trade-off. Orlistat only works if you're following a low-fat diet, because high-fat meals can actually lead to oily, super oily stools, urgent trips to the bathroom, and some very uncomfortable side effects. But if you're looking for a non-systemic, non-stimulant medication to maintain weight after GLP-1s, this is one of the few options that stays entirely in your GI tract. But here is the issue. Most people gain weight not because of cholesterol intake, but actually calories in general, usually from processed foods or excessive carbohydrate ingestion. Orlistat does nothing for that, so you may be fixing a problem you don't have. Now let's talk about number 5, phentermine. It's been around since the 1950s, and yes, it's still prescribed today as a Schedule 4 controlled substance. Phentermine works by suppressing appetite through the sympathetic nervous system, basically flipping your fight or flight switch to lower hunger. It's FDA approved for short-term use, which turns out to be about 90 days before it's recommended that you take a break. But in practice, some providers use it off-label for longer periods under very close monitoring. The upside, it can absolutely help curb post-GLP-1 appetite spikes, especially in the first few months after stopping semaglutide or tirzepatide. The downside, increased heart rate and blood pressure is very common, and there's potential for dependency if misused. So for short-term bursts of support, yes, but this is not a forever medication. So this is more of a possible bridge medication and less of a maintenance deal. Well, if you like the appetite suppression of phentermine, but want a safer long-term option, then maybe number 5, phentermine plus topiramate ER, sold as Qsemia, might be your answer. This combination medication gives you 2 mechanisms in one. The phentermine suppresses appetite, just talked about it a couple of minutes ago, and the topiramate adds early satiety, mood stabilization, and even some binge eating protection. It's FDA approved for long-term weight management and not just a quick fix. In post-GLP-1 patients, Qsemia can also act as a bridge medication. It doesn't carry the same GI side effects, and it smooths the transition between your once weekly injections to oral medications. And if you've ever struggled with food noise creeping back in after stopping a GLP-1, Qsemia might actually keep that noise turned down. A rarely used but powerful and specialized option comes in at number 6, but it's worth knowing about. It's called setmelanotide. It's sold as Imcivree. This is a melanocortin 4 receptor agonist approved for patients with rare genetic disorders like POMC, LEPR, or PCSK1 deficiencies. Trust me, if you have these issues, you know you have them. And while it's not for general obesity, there's a growing conversation around its use in select patients who don't respond well to traditional weight loss medications or who regain dramatically after dropping or stopping GLP-1s. Bottom line, if you've been told you just need more willpower, but nothing ever worked except for GLP-1s, and now the weight is coming back, this might be worth discussing with a specialist, an obesity specialist specifically. Finally, an off-label sleeper comes in last but not least at number 7, topiramate all on its own. Yes, it's FDA approved for seizures and migraines, but also has off-label benefits for appetite suppression, weight loss, and binge eating disorder. Not often used in this way, but your obesity expert might pull this card if there's no other good option. You stuck around to the end, so now let's talk bonus information. If they dropped off early, they're gonna miss out. Weight loss maintenance is an individual process as every patient has their own metabolism, barriers and triggers, and more. There is no one size fits all in any lifestyle change strategy, and there's also no way to escape the 5 pillars to maintain your new habits. So bonus number 1 is my 5 pillars. Remember, if you do or don't decide to use a medication for maintenance, what I call the 5 pillars is going to be clutch: nutrition knowledge, excellence in exercise, sleep hygiene, stress management, and mental and emotional health awareness. Bonus number 2, if you can afford it or if it's covered by your insurance, staying on the meds is just fine. Zepbound and Wegovy both are FDA approved as maintenance therapy, so if you need to stay on the medication, in my practice, I keep my patients on the lowest dose at the longest interval. That keeps my patients' weight at goal. After that, we keep follow-ups for every 3 months or so to make sure everything is going well. So if you found this helpful, you'll love my free GLP-1 bootcamp. It's a 14-day jumpstart with nutrition tips, supplement guidance, and the most common questions I get from patients, just like this one, completely free. The link is in the description below, and if you haven't already, hit the subscribe button, please. Only 20% of you watching right now are subscribed, and I want to keep making the kind of content you want to see. So stay healthy, stay informed, and I will see you soon.